Okay, good morning, everybody. I'll just let the few people who are just arriving take their seats. So I hope you've all recovered after our little social in Manchester Museum last night, and I'm so pleased to see so many of you here bright and early at 9 o'clock this morning. I'm going to introduce the first session for today, which is a plenary panel on the role of leadership in nursing informatics. I'll let Nicola Ranger, who's our President and Chief Executive of the Royal College of Nursing, introduce the panel members in a bit more detail in a minute. She's going to chair the session for us. For those of you in the audience who don't know much about the way our health service is organised here in the United Kingdom, sometimes people think that it's one big organisation, but in reality the United Kingdom is made up of 4 countries, England, Scotland, Wales and Northern Ireland, and the organisation and delivery of healthcare is devolved to those 4 nations. So within our NHS we actually have 4 different health services and 4 different NHSs. And we have 4 very different approaches to the role of leadership in nursing informatics across those 4 countries. So the panel this morning is going to discuss and talk about our different approaches to that role of leadership in those 4 countries, which vary in population and context. So it's without further ado, I'm going to hand over to Nicola Ranger. Some of you who were here yesterday for the opening ceremony will have already heard Nicola speak. She's the General Secretary and Chief Executive of the Royal College of Nursing. She has a long history of leadership in nursing in the UK, with roles as Chief Nurse at 3 different NHS trusts in England. So over to you, Nicola, for this morning.
Good morning, and I want to say welcome to those of you that weren't here yesterday. It was great, and a huge thanks to Pam, who just gave the most inspiring talk yesterday. And I've only been here since about 4:30 yesterday. I spent the evening thinking, oh my goodness, as the Royal College of Nursing, there is no way we are doing enough in digital nursing. So job done already with regard to conversion to what we need to do. But I'm absolutely delighted. I'll just take one of the roving mics actually to have some of our leaders in digital nursing across the UK here today. And I'm absolutely delighted that the 4 of you can be here. And I'm just going to ask them a few key questions around their leadership journey into the digital and informatics. And then you'll get a chance, after I've asked a few questions, we'll take some questions from the audience. So actually, thank you very much for being here. Delighted that you've been able to be here. I know you'll all have different experiences, but I just want to ask you some key questions. And actually, Claire, I'm going to start with you, if that's all right. Could you tell us a little bit about your leadership journey and how you ended up being a CNIO or lead nurse for informatics in Northern Ireland?
Good morning, everybody. My name is Claire Bushner, and I'm the one at the end of this row with the funny Northern Ireland. Just closer. It's okay? Yeah, so I'm the one with the funny Northern Irish accent. So in Northern Ireland we have a population of 1.8 million, so we're really only the size of Manchester, so small and beautifully formed. My journey started, I'm really afraid to say this, and I know I don't look old enough, 22 years ago, thereabouts, when I was the subject matter expert, the nursing expert on an IT project, a European project. This was in 1996. Pre-internet, pre-smartphones, pre-mobile devices. When we used telematics, we created a 5th channel on the people's TV, and it was to give family carers information about moving and handling and incontinence and various different caring roles that they might take on to support family carers looking after somebody at home. And on top of the television, we had a video camera where they could access nursing care 24/7, to a health centre during the day and to a hospital at night. So if they were worried about the person that they were looking after, they could video conference. And that was way before its time. You know, it was a large PC behind the person's television in their front room. And that was where my love of digital happened. And I said, oh, there might be something in this digital thing. Maybe I should think about looking into this. This might be a great career opportunity. And I went on and did a master's in health informatics, self-funded, distance learning. I was the first nurse that the University of Central Lancashire ever had on their health informatics programme. And I was their most distant distance learner, coming from Northern Ireland. But it took me another 12 years to get into a job where that master's and my digital skills were actually utilised. And 12 years ago, I took up a role as a nurse consultant, actually, looking after and being the clinical lead for a remote telemonitoring Northern Ireland service, which again was way ahead of its time. We talk about virtual wards now. It was a virtual ward, regional, across the whole of Northern Ireland, an end-to-end service where we monitored people with chronic illnesses. And my role there was to design what that service looked like, design the clinical governance, support and train the staff in the triage centre and the staff on the ground, and redesign services to use the remote monitoring. And my role has just developed since then, and now I have a regional role in the Department of Health, supporting nursing informatics. But it has been self-funded, it has been self-taught. There wasn't really any capacity and capability frameworks or career pathways in those days, and I suppose I've just found my niche, whether I fell into that by accident or not. Thank you.
I think what's interesting about that is the difference that you've made to patients within that, and that wasn't fully recognised. You've had to fight quite hard to get where you are, but thank you. Fran, over to you.
Hi everybody. So I am the Chief Nursing Information Officer at Digital Health and Care Wales, which is the national IT organisation in Wales. Wales is made up of the population of 3.3 million, so a bit bigger than my colleagues. My journey started in 2003, where I worked in the United Arab Emirates for the government of Abu Dhabi, and they were implementing an electronic health record, quite a large one at that point. So I essentially came in at the ground level, just helping support the development of that system, but making sure all along the way that the nursing voice was really heard. Because I think, you know, you will hear it a lot, is that IT has been done to nursing. Well, actually, I wanted to make sure that nursing were involved in that process. So, like Claire, it's really quite interesting listening to other people's journeys. I really found my niche and what I really, really wanted to do, because I thought it was really important to understand. It's all very well putting the documentation in, but it's what happens at the end of the data and the outcomes. Have we improved patient outcomes? Are we making our nursing staff document stuff that is actually not relevant? So how do we ensure that we streamline areas of documentation and workflow to make sure that people have the right information for the right person at the right time? So I, like Claire, self-funded and did a distance learning one. I can beat you because I did mine at the University of Sheffield. And so that was real distance learning across thousands of miles. Self-funded and completed my master's to the point when I left Abu Dhabi in 2016, I was advising the nurse directors of the government of Abu Dhabi of how to do digital. So saw my role advertised for NHS Wales, and I was like, do I really think I can do this role? Came back to the UK. And at that point, I was the only digital nurse leader in Wales. To the point now where we have over 100 digital nurses in Wales, and that's part of the leadership role that I've been able to take on to make sure, like Pamela said, it's about nurses. It's about nurses being at the heart of everything that we do digitally, and make sure that we develop fit-for-purpose solutions. So I think, you know, the key message for me is, like people have mentioned, it's getting that clinical nursing voice at the table right at the very beginning.
Thanks so much for that, Fran. I think you're right. In the UK, I think nurses sometimes feel that IT and informatics is done to them, not with them. So I can really echo your thoughts on there. Thank you very much. Mark, over to you.
Good morning, everyone. I'm Mark Fleming. I'm the clinical lead for nursing in the Digital Health and Care Directorate at Scottish Government, working in collaboration with a group of other clinical advisor colleagues, very closely with my allied health professional colleague and working with our medical colleagues. Our role there is to advise the Digital Health and Care Directorate and the Chief Nursing Officer and Chief Allied Health Profession Office in the government in relation to all aspects of digital, in relation to policy and delivery of those particular areas. I think as Dawn said, the setups are completely different. Scotland is a devolved health nation. We have a population of about 5.5 million. The geography of Scotland is very diverse, from city populations to wild, island and rural populations. The landmass of Scotland, although you won't believe it from the BBC maps on the news, is bigger than Wales, Northern Ireland and England put together. Not that I'm boasting that we're bigger than you, but we are.
You can tell there's a bit of competition in the UK,
Yeah.
can't you?
I'm the only guy here. I've got to stand up for myself. So my background in digital goes back to nearly about 17 years or so. I'm a registered mental health nurse by clinical background, so I was delighted to hear Pam yesterday talk about that community environment and the difference that nurses can make in digital in those community areas. And probably my main focus in the other part of my job, so I'm not a full-time employee at Scottish Government. I only work there 1 day a week as an advisor. I'm a nurse consultant in digital and the digital nurse lead in my NHS board in Ayrshire and Arran, which is just south of Glasgow. So I work there as a sort of clinical lead advising the board on all aspects of nursing, but primarily because I'm a registered mental health nurse, that's my background, and my passion is working in those mental health, community, child health, etc. areas in the community environments, working within our health and social care structures that are there, but also closely linking into our acute hospitals. And it's that bridge between hospital and community care for me which can make the real aspect of difference for digital, that transition of care between hospital and community that can support that. So I lead on a number of areas within Ayrshire and Arran, working on technology-enabled care, so remote monitoring, self-management, those types of aspects, but also those interfacing components of sharing information, making it easier for people to get in and out of hospital when they need it, and then supporting the appropriate hospital care and provision in that area. One of my sort of key aspects going back, one was my operational clinical role, working as a community mental health nurse out of hours, in the weekend, in the evening, sitting in a room taking calls from really, really distressed patients, and I had absolutely no information in front of me at all, and I had to make some very serious and difficult clinical decisions on their care and management, really on that discussion with no history, no care plan, no records on absolutely nothing, and that was quite scary for me, and we felt that we needed to do something about that. So I was then seconded into a role. We got some money from Scottish Government in order to look at developing clinical pathways for patients with mental health, but also looking at digital information systems to support the monitoring of outcomes and the records of that. We bought a system, we implemented it. I was leading on that programme. But one of the key things that we did in that programme as well is we sat down with a group of people who used our service and carers of the people who used our service, and talked to them about digital and talked to them about what could digital do to you. And the key thing that stands out for me is, please don't make me tell my painful story more than once. Please, if you can do anything, allow people to read what I've taught and don't ask me again and again and again what my problem is, because you should know. And that's always stuck at the core of putting the family and the patient at the core of things and making the information available to people round about them. And I suppose that ethos is always built into me right from the very beginning, that whatever we do, we need to keep the patient at the centre of that. And we need to work in collaboration with our other professional colleagues so that they don't go off and do that as well. and try and work as a team and collaborate as a team in order to build that infrastructure from a digital perspective and make the information available to people to support that journey of care in and out of hospital, back to primary care whenever we possibly can. So that's my mission in order to keep it going. I did retire and return last year, and now only work 3 days a week. But I'm happy to do that for a few years just to keep things moving, to support that transition across to the younger people within our organisation to pick up that mantle. We in Scotland, we've got a network of nurses and allied health professionals and midwives who work within the digital space. We collaborate and work together. We work in collaboration with our educational colleagues to build that leadership programme, to build the educational framework that's round about it. We've got a new master's programme in Scotland, which is similar to the Digital Academy in England, where we're bringing people through and bringing people on. So it's building that capacity and building that growth. But I think you're right, we need to do something more collectively with the chief nursing officers to get the message that these roles and also the board roles or the trust roles are absolutely crucial in delivering this. And many of the people here will be those future leaders in order to do that. And we need to pass our knowledge and information on as to how we do that best to the other groups.
Thanks so much, Mark. I think that was vital. And I do think there is something about in Scotland, it isn't just rural, it's remote. And it does make you think differently. And I think such an important point about patients not having to tell their story. It's such a trivial thing when I was looking at reapplying for my mortgage, when I rang up and the person straight away, speaking to somebody else, repeated my information back to me. I felt so much safer straight away that they knew what they were doing. And I think for patients, how safe would you feel when straight away someone knows all about you and what matters to you? We make people feel so anxious when they have to start over and over and over again. They feel like we don't know what we're doing. So it's such a vital, vital piece. Last but not least, I'd like to introduce Helen.
Thank you. I'm Helen Bolston. I'm the Interim Chief Nursing Information Officer at NHS England. When I first started in my nursing career 30 years ago, the only person that had a computer was the ward clerk. And that's where we used to track who was where, and we didn't dare touch that computer overnight. We updated an Excel spreadsheet because we weren't to be trusted with that technology. And as I've gone through my career, more and more technology's been in place. Most of my clinical career has been in cancer care, haematology, bone marrow transplant, and that's where I first got the digital bug, because one of the things that I led was implementation of e-prescribing for complex chemotherapy. And I was like, oh yeah, another piece of tech, okay. But actually it revolutionised so much for so many. It was a university teaching hospital in Cambridge. We'd got over 50 academics, and everybody liked to do their own thing. They were all different, all special, and there'd be nuances about this consultant's protocol versus the other. And we had to standardise and reduce that variation. But that gave nurses a voice, and which was really powerful, because they go, that doesn't work in practice. When they're in the day unit, this is what we do. And so we built it ready for the nurses to give, and they felt that they'd got the biggest voice that they'd ever had. And actually that was really powerful, because suddenly we had a little bit of capacity, not loads, but because we had the data, we could start looking at what we did and how we did it more comprehensively, which was, again, really revolutionary for nurses to be in the driving seat, to have data to inform decision-making rather than some of that antidote. But probably the piece that was at the heart of that for me was we could give people a plan for the next 6 months for the whole of the chemotherapy. Always caveated that actually that might change next week if you come in with an infection. But actually for people who didn't have any control over what was going to happen to them during that cancer journey, that little piece of paper meant the world. And they accepted quite quickly that actually it might keep changing, but actually this is my plan. This is what's going to happen to me. After we'd done that piece, the organisation was going through a big change, and my job wasn't going to be the same again. But one of the jobs they'd advertised was a nurse to lead the digital implementation of Epic across the hospital. It was an interesting scenario because it meant me going in 6 months before we went live, and it was an organisation that actually hadn't had a nurse in its leadership role. We'd gone through 5 chief nurses in 5 years, but not one of them had said, we need a nurse leading this programme. They'd all thought, oh, it's all right, the deputy can do this. And actually, the chief nurse that I worked with went, the deputy can't do this. This is a piece in its own, and it's not where it needs to be from a nursing perspective because they haven't had a nurse at the table. So I stepped into that role, and it was a baptism of fire 6 months before we went live, when so many of the decisions had already been made. And yet, we needed to change quite a lot. I found gaps of things we hadn't built. And it was a case of, okay, let's make it safe enough, and then let's do the change. And actually, that was probably really powerful for me, because over the next 2 years, I worked with our data team, our frontline nurses. We built a collective, which we now call Shared Decision-Making Councils. And between us, we rebuilt every piece of nursing documentation. But it's not about the documentation. The most powerful piece in that was that we debated professional practice. We actually talked about, why did you do it that way in surgery? And they did it that way in oncology. And on medicine, we do it this way. And in pediatrics, we need something quite different. And it was one of those things that actually I'd never seen nurses debate what we do and why we do it before. So it's so, so powerful. And because of those conversations, we actually reduced quite a lot of variation. We got adoption really quickly, and we kept that change journey going. I was lucky enough that I'd got people that wanted this, saw the benefit of all of this, working alongside. And we took the organisation to HIM Stage 7 across a number of years. So we changed everything that everybody in that organisation did. But I think the biggest change was to nursing practice. One of the other things that I'm really proud of was the work we did on the patient portal. And actually I had patients working alongside me saying, no, this doesn't work for us. These would be our priorities. Can you build it this way? That's a bit more intuitive than that way. And it was so, so powerful. And the feedback from them after just a couple of years was phenomenal in terms of the difference it had made to help them manage their lives. Many of our patients were long-term condition patients, renal, cancer, transplant. You know, they'd come from lots of different directions, but actually giving them a voice in decision-making about how we build tools that they would use, it's phenomenal. But after 7.5, 8 years in that role, I was like, oh, I want something different. I don't want to keep going. What am I going to do? And actually, my predecessor, Natasha, put in some fellowship roles. And I thought, oh, that'd be quite good. I'll step out for a year and see what happens, because I wasn't sure whether this was where I wanted to be or not. In the national context, the national bodies such as NHS England, very clear role, policy, standards, enabling, bringing together those experts. So I was sort of like, it gives me a foot in the water to see what happens. And I stepped out, and I've never stepped back into the hospital. Had a fabulous year working with Natasha, started a journey of looking at documentation. Told you about my journey in Cambridge, but actually what I saw when I stepped into the national team was that across the whole of the landscape. And it didn't matter whether you worked in community, mental health, social care, or hospitals. Everybody had got the same challenges. So we're 3 years down the line with a programme of work around documentation, but probably at least another 13 to go, because it is a long journey. And a lot of that, though, is cultural shift. It's us as nurses understanding what we do, why we do it, and what we need to document, but also using the technology to help us. And I think there's a lot of tech coming along that's going to make quite a big difference in that space. So I see my job as bringing all of that together, looking at the horizon and working out how we position that so that as nurses we make sure that we go together. We've built huge collaboratives. We've got 7 regions across England. Some of them are bigger than some of their countries. That's my competitive piece. But actually, we've all got common stories, and it doesn't matter where in the UK we come from. What we hear is people learning and using those networks, that social movement we've created, to be the change and be the change agent in their organisation. So I was lucky enough to step into the national role 18 months ago, and I can still see there's so much more to do to make sure that we reduce that variation across the country, make sure our digital systems work for us and really enable technology of the future. We've got huge variation in digital maturity, so there's still a long journey left to go. And it's important that nurses have a loud voice in that journey. I'm lucky, I work across 2 directorates, so I'm based in the Digital and Data Directorate, but I actually have a direct line to our Chief Nurse for England, which is really powerful to have a foot in both camps and hopefully make sure we can give the profession what it needs for the long term.
Thanks so much, Helen. I think your point on documentation, when I was first chief nurse at Frimley Park, a hospital just outside London, the admission document was 30 pages when I got there. We got it down to 5, but what I'm seeing, with the speed to put suddenly paper systems into electronic systems, not enough thought is being given around how we properly assess patients. Because the sad thing is, from my own experience, people collect so much, but so often can tell you so little about the patient. So there's a real cultural shift there as well, isn't there? Thank you very much. The next question I'm going to start with Fran, if that's all right. What do you think are the key factors that make good leadership in this space?
Right. So one of the key things for me, the good clinical leadership is around collaboration. So like Helen in Wales, we have a direct line to the Chief Nursing Officer for Wales, along with our national organisation, to ensure that people work together as opposed to against each other, and we ensure that we align with policy and professional requirements along the guidelines, which is why, you know, like Helen has mentioned, with the documentation, we in Wales are quite lucky because we've standardised our documentation across the whole of Wales, and part of that is about how we've not replicated a piece of paper. Alongside, it's about looking at the process as much as it's looking about the paper, but actually the assessment documentation is developed with our patients. So again, being collaborative and working together with our nursing colleagues, our patient population, but at the same time being approachable, because I think, you know, as a very new profession, it's sometimes very hard even for our nursing professionals to understand what the profession is. So we need to take and guide people along with us. So for me, it's about being authentic and true, being collaborative, whilst at the same time being approachable, but alongside fairness and equality to make sure that everybody's voice is heard.
Thank you. Same question to Mark.
I suppose I could give you all the easy bits about leadership, about visibility and all the rest of it, but we don't actually, I'm going to say something a bit controversial, we don't make it easy for ourselves from a digital space perspective. We all work on the same principles of provision of NHS care, you know, free at the point of delivery, etc. And we all have the same ethos of what we do. But you described us at the beginning, all with different titles, all within different structures, and all probably at different levels in different parts of our pathway, you know, within our career aspect of it. And that career aspect of that leadership aspect is key, and we don't have a career journey for people who want to be involved in digital. We don't have that framework there embedded into our pay framework or our competency framework properly embedded in there in order to bring people on and bring people into these types of roles. We all sit with different job titles, different job frameworks. If we could do something to collaborate and pull that together for the 4 countries, the 5 countries including the Republic of Ireland as well, who we work very collaboratively about, I think that leadership might be easier for us, but we just make it very difficult for ourselves because we all are at different levels, and if we had some sort of structure that was in there, that would help us make it easy. So we need to be brave. So that's one aspect of being leadership, is being brave to ask for that and work with our professional groups and with our CNOs in order to try and bring that forward. We're in a very difficult financial position in order to make that happen. We did have our discussions with our CNO a couple of years ago. Wasn't the right time, there's no money, still no money in order to do it because it's going to take change in order for that to happen. So we need to be brave. We need to be visionary, and I think we all collectively say that that framework will help take us forward and on that journey to bring people through into these particular roles and jobs at a variety of different levels, because we need digital nurses at lots of different levels in order to do it. We operate in the strategic space, but we need nurses working on the front line and the coalface in order to provide that aspect as well, and all the usual aspects of leadership that we can bring to the table.
Thanks so much. I've certainly made a note to myself about trying to influence the CNOs, because I can see that already. And,
Job done, Dawn.
yeah. And actually, I think you're absolutely right about we need to be brave and change. I was totally inspired when Pam shared some of the work that's going on in countries like India. And this is the key to our challenges. And I've come away with the thought we can't afford not to spend money on this, because it is the key to brilliant patient care.
It makes the patient experience much better. It will help retain our nurses.
It will.
It will help take the pressure off our nurses, because I would probably say 60% of them are burnt out after the pandemic. We need to refresh things and build and investing in digital and bringing that digital change through is one way of doing it. It's not the be-all and end-all, but it's one way of doing it.
Thank you very much.
I agree with everything they've said. A couple more points, if I may. And I think one of them is about not assuming we have to do everything ourselves. We do work in multidisciplinary teams when we give care. And I think some of the role we have in these jobs is about using the communities around us. How do we make change happen? I've been working with our regulator, the NMC, just to go, how do we review the code? How do we review standards of education and training for nurses to make sure that digital and data use are all fundamental to those? But also then, how do we work with organisations such as the Council of Deans that actually have oversight across what's happening in all of our higher education institutions that could help us actually bring that to life? We're seeing such variation. And some people worried about the impact of students using ChatGPT, and others going, oh yeah, we dealt with that 2 years ago, that's an old issue, you've got to change the way in which you teach. So we've really got to bring different people to the table. We can't solve it all ourselves as digital nurses, and I think that's about using the voice of the profession and taking people on that journey. Our chief nurses across all organisations are probably the key to some of that. But actually their experience of digital is as variable as everybody on the front line. So we've got to help them really see the journey that we're going so that they can make sure that voice is heard at board level, executive level. But it's also about bringing the voice for good. I was really privileged to host a roundtable looking at AI for nursing. And I was just so amazed. Some people from the audience here, around the world, people were giving up their time to advise us in terms of where do we go, where do we start. As many of you know, there's very little AI that's made it from research into practice for nursing and midwifery. So we were going, where do we start? What does that look like? And it was fabulous, that voice, the power, bringing it together, collaborating on that big scale to really make sure that we're giving the profession the right tools for the long term.
Thank you very much. Thanks very much. Then last but not least, Claire.
I take all of that and we'll add one more. I think for me it is about, and at our level, at regional and country level, being a nursing informatics or digital nurse leader is quite a privileged position. I find that I'm in quite a privileged position because I do have that helicopter view from where I sit. And I can look over, and in Northern Ireland, we have an integrated health and social care system. So it's about understanding. You have to have that understanding of how the system works, so that when you go then to work with frontline staff and services, that you understand how their service actually works, and that you can work collaboratively and effectively with them. So being able to join that dots, I would emphasise that as a leader at regional or country level, you don't need to know everything, but you need to know where to go to find the answer and who it is that you can collaborate with to make sure the thing works properly and is efficient and effective for everybody using it. But I think the one other thing that I would add is that you have to have an empathetic outlook on what is actually happening on the front line. When you're not a frontline practitioner or clinician, sometimes it's hard to remember, or you sometimes forget the pressure and the challenges of delivering health and social care on the front line. And often I think, do they see me coming in with my vision and say, oh, we're going to redesign how you deliver community nursing, or we're going to redesign how you deliver care to patients living with diabetes, and they roll their eyes and say, oh, here she comes with her ideas. Does she really understand what I'm going through on a daily basis? So as a leader, you need to understand what the challenges are, and emphasize the work collaboratively so that the time's right.
I think that's such an important point to never lose sight of that. There was some research done in the UK, in England actually, by Professor Alison Leary on the amount of time that community nurses should be spending with their patients, and saying no more than probably 10, 11 patients a day with regard to visits. I spoke to some district nurses in North London. They were on 25 visits a day with 15-minute intervals. So that was their reality. So you're absolutely right. Staying close to what the reality is a really important point with regard to keeping people with us on this journey.
And it has to make their job better.
Easier. It does.
Nobody is ever going to change and go on the journey 100%. With them unless they can see the benefit of how it is going to make their working life better. And exactly the same for patients. No patient is ever going to sign up to use a patient portal or join you on your digital journey unless they can see the benefit in it for them. The what's in it for me argument is very strong.
Thank you so much. I completely agree. The next question I'm just going to get Mark to start with. You talked earlier about being the future informatic and digital leaders in the audience. What advice would you give to aspiring nursing informatic leaders to help them develop their career?
Don't ever take no for an answer. I never ever did, and certainly don't take no for an answer from someone that doesn't understand what you're asking for. But always have the evidence to back up what you're saying and to ask the right questions. Probably do it in collaboration with other people. Collectively have discussions and go and ask the questions collectively, because collectively we can be quite powerful. If you do have digital leaders in your organisation, collaborate with them and do it collectively, taking it forward. Get yourself involved in developing your knowledge and skills in that area. I think we've got a lot to do in relation to building that knowledge and skills framework with an agenda for change properly and getting that career framework. So we need to try and have that framework there for people to collectively sign into, so that they can build their skills and be recognised for it, because I don't think people are properly being recognised for developing their skills in those areas. Get to know your technical people. Try and explain to them what you're trying to do. Bring them to your ward, community environment to demonstrate and show them, do some showcasing with them as to the challenges that you're facing and how collectively you might work on bringing solutions to it, because it's not all about clinical solutions. There are technical solutions that they may well know about that can bring it forward as well. Work in collaboration with your data people in order to make sure that the outputs in the data are built in there as well. Also work in collaboration with your clinical governance people to make sure that your clinical guidelines, etc., are being built safely into the systems that you're doing. But primarily, don't take no for an answer.
Thank you very much.
I think it's about doing good work in the job you're in. And I think we often forget that, but if we've got junior nurses, and I get many people going, I'd like to step into digital, what do I do? And at the moment, the jobs are few and far between, and they're generally at a higher level. And there's lots of variation in the types of jobs. Educators, analysts that are more technical, clinical safety officers, digital transformation leaders. I think it's important to have that conversation about what interests you, what's your skill set, how are you going to bring it to the table, but essentially use that skill set in the place that you're in and show people how good you are. You know, you do an improvement project, use data, bring people around you, and I think have a coffee with your Chief Nursing Information Officer. You know, I think we all want to spot talent, and sometimes we don't see that. We need somebody to go, can I come and have a conversation with you? What does that look like for me, and how can you help me? How did you get into this job? And what do I need to consider?
Brilliant, thank you. Claire, you go next.
me.
And then I'll go back to Fran.
All again about collaboration. I think it's about finding your tribe. It can be quite lonely. You know, if you listen to our four stories, we all started years ago, and we were the only people. You know, I was the only digital nurse consultancy NIO in Northern Ireland for a long time, and now I'm not. And it can be a lonely place, and you know, your clinical colleagues who are maybe going off to do a program in, you know, a clinical specialty, you know, when you say, well, I'd like to go off and do something in digital, and they look at you as if you're a bit odd. But it's about perseverance and finding your tribe, and I think Mark and Helen have said, you know, it is about that, you know, seeking out other people who have the same interest, and they will be able to guide you, seeking out information from, you know, professional bodies and colleges that we have. You know, there's lots of information out there, and not wanting to jump on to the final question, we as nurse leaders and organisations and as a profession, we need to make it easier. It's very, very complicated out there. If I was starting out now, and we do get it through the Royal College, through the forum, you know, I'm interested in being a digital nurse, where would I go? And even those of us who are on the digital nursing forum sometimes go, ooh, where are we going to direct them to? Because there's so much out there. So we need to make it easier, but seek out advice from those perhaps a little more mature in the career pathway that might be able to guide.
Fran, last word to you.
Thanks. I would say don't be afraid. You know, I would say we're all our own worst enemies, and I think that sometimes as a profession, we do that. We put ourselves on the back seat, you know, click that thing off your shoulder. The CNO is approachable. The CNIO is approachable. Knock on these people's doors. You know, like you said, mentor somebody, go to somebody, look within your organisations. But sometimes I think, you know, like I said, don't be afraid of yourself, because people are completely approachable. It's what we put on ourselves that makes us not approach people. And just, you know, go to people for advice. And I think, like I say, everything that everybody else has said. But, you know, as I would say, as a collective of the nursing informatics leaders in Wales, one of the core things that we've actually recognised is that there are so many places to go, that there is no single point of truth. But yet our frontline staff, our people who want to come into the digital agenda, are telling us that they want a single place of access. So us as leaders should influence that, and we have developed a memorandum of understanding between us all that we'll work on something as a collective, because we need to understand what you want as much as we can be able to influence elsewhere. But until we recognise that in ourselves, by asking and talking and networking and collaborating together, we are a force to be joined together. And I think, you know, for those people going on those digital career journeys, use your people around you to influence, and that means knocking people's doors down and being brave.
Thank you so much, Fran. I absolutely agree with that. We've got time for one more question from the audience, if anybody would like to ask our brilliant panel a question.
My name is Ursula Hübner from Germany. Thank you for this wonderful and inspiring panel, I always had to nod and can't stop nodding. So thank you very much for this. I have a question concerning the new horizons through AI, and what are the particular role of leadership in this context?
I think it's about assessing the opportunity as well as assessing some of the risks. I'm lucky, we've got a team that's been looking at AI ethics, where does that fit, making sure that there's the structures and processes around the NHS to make sure that when we adopt AI, it's safe and there's some fundamentals in there. But I think from a nursing perspective, the things that we took away from some of those conversations is helping nurses understand data, their core skills, but understanding the value of what they document, because it's that data that we're going to use to create AI. But it's also using it for good and recognising where the potential is and where the biggest opportunities are, helping us solve some of those bigger questions and issues. I think some of the ambient documentation is probably where it's going. We'll always have to document care, but can technology help us do it smarter, faster, safer? But it is that safer piece, because a lot of our work is in an inpatient setting or a community setting one-to-one, and the technology's not really been tested in those areas. It's a lot in outpatients, so there's a lot to learn, but it's quite different as well. Cultural change, again, getting nurses and midwives used to talking and having that conversation. But I think it's about how we equip people, how we expose people as well. We've been lucky enough to get some fellowships. Sadly, it's a multidisciplinary fellowship. We didn't get nurses this time around, but it's an opportunity there for us to get nurses truly immersed in building AI as part of a multidisciplinary team. So I think there's lots to learn.
Yeah, I'm hoping that the 4 countries are at least having some conversations about how they can work in collaboration in relation to AI, because I think we're all in different positions in relation to this, and also how we can work in collaboration with our education colleagues, etc. in that space. I think it's challenging for many of our frontline practitioners, because in the last 4 or 5 years they just haven't had the headspace to think about it. I don't think we are mature enough in relation to the data that we're collecting and the proper structured data that we're collecting to potentially safely feed our AI aspects. So I think that, as Helen said, I think there's a lot about those clinical safety pieces and making sure that we're collecting the right data and it's validated and it's correct and all the rest of it before we start to think and feed those particular aspects of AI. It's hugely exciting. It's hugely to see where AI can support us in the provision of nursing care. But I think we need to just think about it and bring our frontline practitioners along with us on that particular journey as well. And I don't think they've had the headspace to do that during the pandemic and after that in the delivery of care. So I think we'd maybe just need a wee bit more time to promote, think, understand it, but work in collaboration with other areas in order to explore how we can take it forward.
I think the one thing I would say is about language. I think people flippantly use the word AI as meaning something major. And I think there is something for us in leadership roles to be able to translate that. I echo what Helen and Mark said. I was part of that roundtable. I think the basics, we don't have the basics there yet. I think we do have elements of AI, currently clinical decision support. Now, as a clinician, they'd probably understand the word clinical decision support as opposed to the word AI. What does AI mean? People see ChatGPT, these cloned bodies and everything. So I think it's really important when we have those conversations, whether they be with frontline staff or our nursing leaders or our multidisciplinary leaders and our technical people, that we talk in a language that people understand. And actually, if we don't get the basics right, then we're not going to get what we want out of it to improve outcomes for our patients and citizens across the UK.
Yeah, I'm also nodding at everything that they have said. For me, it's very similar to Fran. It's about busting the myths, because I think if you went into any frontline clinical area in our community and you said, oh, we're going to introduce some artificial intelligence in the way that you work, the nurses would probably, you know, fold down the laptop or turn off the device and say, this is not what I come into nursing for. This is, you know, it's about human and person-to-person interaction, etc., etc. But if we went in and we said to them, we're going to introduce a way of working that's going to make it safer and be more efficient, you know, use the data in a more efficient way to improve your clinical decision making, they would say, okay, well, let me listen to how we might do that. So it's really what Fran said. It's about busting those myths and making sure we're talking the same language and defining it in a way. But I agree, I think we need to get the basics right before we start thinking about anything more exciting. But exciting times for sure.
Thank you so much for that question. I agree with everything everybody has said actually. At the moment, we've got a frontline group of nurses that don't feel that valued. And for all the reasons that Mark said, how we do this has got to be done skillfully with really showing that we value nurses and nursing. Listen, a huge thanks to the panel, Claire, Fran, Mark and Helen. I think we can all say amazing nurse leaders, and I think so much to do in this space. As we said yesterday and as we said today, our patients and our nursing teams need something very, very different. And this and the leadership that you bring is the answer. So thank you so, so much. Thank you.
Thank you, everybody. That ends our plenary session for this morning. I'm sure that our 4 panellists and Nicola will be more than happy to chat to you at coffee downstairs if you have other questions. I'm sure they'll be inundated, may not actually get that coffee.
Don't be afraid, we are very approachable.
Yeah, they are very approachable. So please feel free, you go downstairs to the registration area, there's some coffee and refreshments, and the parallel sessions start at 10:30. So thank you for this morning.